Hi everyone, my name is Dr. Christine Anderson, and I am a pediatric chiropractic functional neurologist. My graduate degree is in Doctor of Chiropractic. My postgraduate degrees are board certified in Pediatrics and Pregnancy, and I have another certification in Childhood Developmental Disorders. So I have been a chiropractor for over 30 years. And my specialty in pediatrics came early, and it was certainly aided by me getting pregnant right after my graduation from chiropractic college. So my career as a chiropractor began about the same time as motherhood. So this is one of the reasons why I'm so passionate about chiropractic for babies and children, because it is so helpful in their development in all aspects. And I saw this with my own children who are now adults. So I have 3 children. They were all breastfed, and they were exclusively breastfed for at least 6 months. I can't quite remember with my daughter and my second child when they began to eat solids, but I know they were at least 6 months, maybe even towards 8 months. And my youngest, however, was exclusively breastfed for 15 months because he had no interest in eating food, if you can believe that. You'd never know it now to look at him because he is taller than I am. He's over 6 feet tall. And he is essentially very healthy and happy, and he has grown up with chiropractic, but he did start off with a home birth in the tub and with breastfeeding. So there are a lot of great reasons why breastfeeding is important, but I kind of narrowed it down to 7 really important ones that I think really show that this is something that is worthwhile to really work at, because sometimes breastfeeding doesn't come so easily. A lot of women quit very early on, and I'll talk a little bit about that later. And it may be worth figuring out how you can work with getting the baby to be able to breastfeed. And I go into that in my breastfeeding and chiropractic video that I did, that I will put a link in the description. So let's just get started with this. So the American Academy of Pediatrics strongly recommends breastfeeding for the first 6 months of life exclusively, and also recommending that breastfeeding continues for 12 months. I did breastfeed all of my children until about 3 years. It wasn't exclusive at that point. By the time they weaned, it was either morning or night, but it wasn't all day, all the time. So reason number 1 is it's the optimal form of nutrition. All the necessary nutrients are in the proper proportions in breast milk, and it provides all the nutrition that baby needs for at least 6 months of life with exclusively breastfeeding. And like I said, it can even extend past that first year. For my third, it was up until 15 months. So the nutritional and the immunological content of human milk is constantly adapting to the baby's needs. And this is what makes it so great, because formula is formula. You can change formulas, but really the nutrition in mom's breast milk is going to depend on what she's eating. So this can be in a good way, because for women who are really having dense nutrients, then they're really making sure that they're getting all that the baby needs. This works in a good way. But if a mom is breastfeeding and not making sure she's eating properly, then the baby won't be able to get this nutrition. So it's super important that mom's diet is really clean, it's really nutrient dense, trying to keep away from fast foods and fried foods and junk foods and sugar and that type of thing. And another key aspect is the DHA, or the essential fats that are needed for brain and neurologic development. DHA, we need to take it into our diet. It's docosahexaenoic acid. It can be converted from our omega-3 fatty acids, but that conversion isn't always great. So it's really good to take your omega-3s, eat your omega-3 rich omega-3 rich foods, but also take in some source of DHA. If you're eating fish, it could be fish. But if you aren't, like I am a vegan, then you would take your DHA supplement. Mine is from marine algae. So let's just go down on my list here. You can see I've got protein, fats, carbohydrates, vitamins and minerals, enzymes, antibodies and immunoglobulins, hormones, and probiotics. So all of these things are in breast milk. And not necessarily all these things can be found in formula. Some formulas are fortified with DHA, but not necessarily all of them, especially in the US. Antibodies and immunoglobulins are the key difference, as well as hormones and probiotics, because these are things that come from the mother and pass down through the baby. So what else did I want to say about this? You can read it there, what these relationships are. But this is why breast milk is the optimal form of nutrition for rather than using formula. Number 2 is the bonding between mom and baby. So it's not to say that if you are using formula with your baby that you won't be able to bond, but that skin-to-skin contact and the aspect of baby suckling at the breasts help produce oxytocin in mom and also in the baby. And this is a what we call the love hormone. It's a bonding hormone, and it is definitely facilitated with this skin-to-skin contact. Babies are soothed by oxytocin and also by mom's heartbeat and smell and voice. So if you're bottle feeding, that aspect is there, but the oxytocin, that hormone, is the key. When babies are suckling, they're at the optimal distance to make eye contact with mom, and newborn babies can see, and the optimal distance is that distance from their head, their eyes, to mom's face. What they found is that the longer you're breastfeeding, that moms become more sensitive to their children's cues. They're more attached. And mothers also who are breastfeeding have less attachment disorganization. And they studied these children up until 11 years old. So again, I'm going with what the research says with breastfeeding, and this is one of the reasons why it's so important to do this. If you can't, you can't, but if you can, it's worth really pursuing. It's also worth it to try looking and seeing what you can do for breastfeeding preterm babies, those who are born prematurely. They might be in the NICU. They found that breastfeeding is important for mothers to contribute to their baby's care and also to help rebuild that interrupted connection because of being in the NICU. All right, reason number 3 is basically a healthier baby. And that healthier baby grows into a healthier older child and then a healthier adult. So the benefits of breastfeeding extend through the years. In general, breastfeeding infants have less visits to the pediatrician because they don't tend to need to go to the pediatrician. And that may be because breastfeeding protects against infections with those maternal antibodies, and especially in the colostrum, which is day 1 to 4 after the baby's born. And this is really before the true milk comes in, but it has so many healthy benefits. Breastfeeding contributes to immune system maturation, including a healthy microbiome in the GI tract, in the gut, primarily bifidobacterium. There are so many benefits with the immune system maturation and the GI tract, and I will be putting links in the description to all the research done. Because of all these effects, breastfed babies are less likely to have ear infections and digestive issues, and these are 2 very common things that can occur in the newborn. Now, later on in life, it's going to help reduce risk of things like diabetes, obesity, asthma, allergies, eczema, and breastfeeding may even protect your child from some cancers. So this is what I'm talking about, that long-term effect of breastfeeding. Reducing the risk of SIDS. SIDS stands for Sudden Infant Death Syndrome. And I really need to do a separate video about this. There's a lot that I could say about SIDS, but we're going to keep it limited in restriction in this regard to breastfeeding, because chiropractic, I feel, also has an effect on helping reduce the risk of SIDS. So I will talk about that in another video one of these days. So they have found, and this is all based on research, that breastfeeding is protective against SIDS, especially if you're exclusively breastfeeding. That's the EBF. Breastfeeding reduces the risk of SIDS by about 50% at all ages. That's pretty significant. And breastfeeding for at least 2 months was associated with half the risk of SIDS. And this is why they recommend to exclusively breastfeed for 6 months, because of this effect on reducing your risk of SIDS. The risk for all-cause and infection-related mortality was decreased for exclusively breastfeeding infants compared to predominantly partially and non-breastfed infants. In other words, that exclusive breastfeeding really made a difference, rather than doing both breastfeeding and bottle with formula, or just completely doing all formula. And this means all-cause mortality, babies dying of whatever, all causes, as well as infection-related. Now, there was a study done by the NIEHS in 2014, and they found that breastfeeding could potentially prevent up to 720 newborn and infant deaths in the United States each year. So this is really pretty significant. Number 5, brain and cognitive effects. Of course, being a neurologic-based chiropractor, this one is my favorite. And your baby's brain grows at a significant rate early on in life. So before the age of 5, that brain is growing to 90% of its adult size. It's a significant amount of growth. And so what they found in general in studies is that breastfed children had higher IQ scores and a larger brain. And this includes gray matter as well as white matter. So gray matter being where the neurons are, and the white matter being the connections, the axons in the brain. And that connectivity is really what helps the brain to function. So there's actually a lot of studies with this. I'm going to put them all in. I just put some highlights here because really the overall impression that is made is that children who are breastfed do have brains that function better and neurologic systems that function better. So those children who were exclusively breastfed had enhanced development in parts of the brain associated with language, emotions, and cognition. And there were other studies done looking at gross motor coordination and other motor coordination, so those can be affected as well. Breastfeeding is associated with increased cognitive behavioral function, and this was based on cognitive and language tests later on in life. They definitely saw a causal relationship of breastfeeding duration, and those children who breastfed for longer had better receptive language, verbal and nonverbal language, and intelligence later on in life. And they also saw that preterm infants could again benefit from breastfeeding with higher IQs, academics with reading and math, and having fewer ADHD symptoms versus the preterm infants that were not breastfed. So there's so many studies that are done with this, but the overall impression is children are smarter and have better access to brain function. And there's even benefits for mom. So for breastfeeding moms, it's going to help facilitate the contractions of the uterus after birth. So the uterus gets stretched out, and we want it to contract back again so that it prevents any complications with bleeding. So it's super important that this is done. And if you've had a baby and you know you've done breastfeeding, when you go to nurse, you can feel that contraction occur. Sometimes it's pretty intense. It's going to help delay menses, and that was one of the beautiful things after pregnancy and birth, is that I pretty much got a year menses free because I was breastfeeding. So it may be a few months. Hopefully for most people they get up closer to a year, because what that does is it decreases your lifetime exposure to estrogen, which is not always, but it can be one of the issues that creates problems with things like breast cancer later on in life. It has a positive effect on preventing urinary tract infection. It improves metabolic outcomes like diabetes and high blood pressure for moms, so helping to decrease the risk of those things. It helps provide protection from some cancers. So for every 12 months of breastfeeding, the risk of breast cancer is decreased by 4.3%. And women who breastfeed for more than 13 months, and this didn't have to be consecutive, it could be chopped up, it could be cumulative from other babies, but if it was more than 13 months, they had 63% less likelihood to develop ovarian cancer. So definitely some pluses for mom. And again, this is one of my favorites, being a chiropractor who also does craniosacral therapy. I've got an image of a baby's skull there so you can see how much different it looks from a human adult skull. Everything's all squished together. That's what makes their faces so super cute. And most people don't realize that as the skull develops, there's going to be deposits of bone in the little islands on the skull. So you can see that they're in pieces, and this helps the baby to be born because those skull bones have to overlap to come through the birth canal, and then they expand and move the craniosacral fluid around, the cerebral spinal fluid. So that cute little skull has to develop, adding bone into the plates that are floating in the dura, and then there's little models of the back of the bone in the head called the occiput, where it deposits bone there, also into the jaw. And the jaw is created in two pieces. There's a connection right at the center. And there's also at the roof of the mouth, you have the palate, which is affected by what goes in the baby's mouth. So a mom's nipple that comes in will help with the shape to make it a more rounded, even shape, whereas nipples from bottles or pacifiers will push the center of the palate up and create a higher palate that can make the mouth narrower and the face narrower, and therefore affect the development of the jaw, the roof of the mouth, how the teeth come in, and it could even affect things like speech, language, but it can affect the whole symmetry of the face as well. Another part of this is that although people will say, well, I am having trouble getting the baby on the breast, I still want my child to have the benefits of nursing with the breast milk, but it's not happening on the breast, so I'll pump and I'll feed the baby a bottle. So I just talked about development of the face, the jaw, the palate, and one aspect of that is it takes so much work for a baby to nurse and get that milk to come out of the mom's breast, and with suction getting it to come into their body. So it's a lot of work. And if they are not able to nurse effectively, that's where some of the problems begin. But that action of those muscles will pull on those bones and then affect how that skull develops. So you won't get that with bottle feeding. Another thing with bottle feeding that many people don't think about is that you are typically putting the baby in the same position. In other words, if you're right-handed, you'll put them in the crook of your left arm and feed them that way, so that the left side of their body is free, the right side is trapped under mom or dad or whoever's taking care of them. And so they're able to move on one side more than the other. And they also see more from their left eye than their right, because the right eye is close to mom. But if mom's breastfeeding, she usually switches one side to the other, and then the baby has equal time of movement and sensory input into their brain for that development. Also, a lot of times, especially as that baby gets a little older, I've seen this, they will prop the bottle some way. So they'll put baby down and kind of prop them up and put the bottle there. And sometimes they won't be holding the baby. And this is usually past the newborn stage. But nonetheless, it is going to be a different sensory input into that brain, and it can make a difference on what is going on with the neurologic, skull, and facial development. I want to just reiterate what I talked about in my video on chiropractic and breastfeeding. Why don't more moms breastfeed? And I found this really fascinating that 80 to 90% of new moms attempt breastfeeding. They really want to breastfeed. And as I just said, all these benefits, you can see why. But by 1 week, half of the moms stop exclusively breastfeeding. So 1/2 are and 1/2 aren't. And at 6 months, only 1% of moms are exclusively breastfeeding. I find that startling, absolutely startling. So this is why I'm doing this series, to kind of help with showing that it's so important to breastfeed that you should do everything you possibly can. And I put down some reasons there why moms stop breastfeeding, and I talk about this in my other video, which looks like this when you're looking for it, and I'll put the link in the description. But if your baby is having any problems with breastfeeding, definitely get them checked out by a pediatric chiropractor. Because if there are misalignments going on in the cranium or the spine, it can affect how the baby is able to biomechanically nurse, and also that input into the system from the brain controlling the rest of the body. In other words, the muscles needed to do the breastfeeding, and also the primitive reflexes, which need to be free of any interference. And I go into all of that on that video, so I recommend you check that out. So this is my website, losangeles-chiropractor.com. I've got a lot of information on there. I do gentle chiropractic on babies. It is not like an adult adjustment. It's very, very gentle, as well as craniosacral therapy. I've helped moms with breastfeeding support. Although I do recommend, if your child is having a problem with breastfeeding, get help as soon as possible, not only from the chiropractor who's trained in pediatrics, but also from a lactation consultant, because they're going to help with some of the logistics. And in a perfect world, I would come in first and do my thing, my adjustments and my craniosacral work, and then a lactation consultant would come in right after and talk about the logistics with mom and see if there's anything needed, like nipple shields or any other devices. This recently just happened with a well newborn visit, and it worked out really well, and that newborn is started breastfeeding right away. So get your newborn in as soon as possible to see a pediatric chiropractor after birth so that you can be on top of any issues, especially to do with breastfeeding. So there's a lot of other things I do with neurologic development that I put down there. I'm also have a diploma in homeopathy, and I have a huge interest in nutrition and also movement and exercise that I like to do in my own life and help other people. So that's it for the presentation, and I hope that you learned something. Give me a thumbs up if you did. If you liked this, share it with others. It's really so important, especially if you know of a mom who's pregnant or trying to breastfeed or wants to breastfeed. It's really important that they understand why it's so important. All right, I will see you next time.